it's me again. I'm Lena and I'm from the Diagnostic group. In this video, I'll be talking about my main video, which is on the 4 diagnostic techniques. Now, what are the 4 diagnostic techniques? Well, the 4 diagnostic techniques are some of the diagnostic methods that traditional Chinese medicine doctors use to be able to identify the imbalances within their body. So, those 4 methods will include inspection, listening and smelling, inquiry, and lastly, palpation. And in this video, I'm going to talk exactly about that. So, what is inspection? Well, inspection is observing the patient's overall physical appearance. Their tongue, which is the most important organ that they are looking for because it can indicate some imbalances in the internal organs like the liver, the kidneys, anything like that. They look for physical appearance, vitalities, tongue, body shape, spirit, color, posture. Moreover, they observe the 5 sense organs, for example, the tongue, the nose, the ears, the eyes, and the hand, as well as the color of the skin, and also the tongue, which I said before, which is the most important organ that they are looking for. Next, what are some of the modern improvements, modern developments for this kind of method? Now remember, I said this is a traditional Chinese medicine technique, diagnostic technique that they use. So people still use this technique today, but what are some developments that could be made to this? So some of the technological improvements. This could include imaging technology, for example, MRI, endoscopy, X-rays, ultrasounds, etc. Any kind of imaging technology in healthcare. And next, listening and smelling. So listening and smelling would include, firstly, listening to the patient's cough, their voice, the sound of their conversation, which is their voice, and then also they will look for their breathing and the body odor. So the odor of their breath or their breath, and also the odor of their body. Now, smelling bad breath and body odor of the patient is another aspect of smelling. So, for example, if I am a traditional Chinese medicine doctor, I will look for bad breath or an unusual body odor. And bad breath can usually, and body odor can usually point out that there's something wrong with the patient. So, for example, the breathing with a wheezing sound can indicate an asthma, and phlegm, which is that sticky substance in your throat with a stinky smell, so phlegm with a stinky smell can indicate that you have abscess in your lungs. So abscess is like an infection area in your lungs. Those are some of the examples for some cases of listening and smelling. Modern developments for listening and smelling can include lab tests, for example, urine, blood tests, etc., to see what is wrong with the body, the urine, and also the blood, to see what's wrong with our circulatory system and our kidneys as well. The next part, moving on to the next part, is inquiry. So inquiry is basically like a fancy word for asking, and basically what this means is that it's asking the patients on their symptoms, their observed symptoms, and also the signs that they have in their body. So they will ask usually they will ask on appetite, sleep quality, urination, bowel movements, emotions, and menstrual cycles. So those are some of the things that traditional Chinese doctors will talk and ask the patient on. For example, if a patient reported headache, which feels like the sting of needles and pins on your skin, if you've ever felt that, that may indicate that it is an illness caused by blood stasis. So some modern developments for this may include medical history taking. And I've said about last week, and I've covered the last week on data recording in patient care, where I talked about the CARET framework, all those things, what the medical history must have. So this will include social history, their past medical history, family genetics, etc. And also some allergies. Finally, palpation. Palpation is feeling, so using your hand. Now, as you can see from all of this, the doctor uses the 5 senses. We have inspection, which is using the eyes, listening and smelling, which is using the nose and also the ear. Inquiry is using the mouth to ask, and finally palpation is using the hand. So finally for the palpation is feeling the condition of the pulse. For example, if you're feeling the pulse right here, it might be faint, faint pulse, but if you're feeling right here, it will be a much more like evident pulse. So touch sites of discomfort, they will be able to touch sites of discomfort, see how the patient responds to that, and also feel the tenderness on the skin. So they will assess the conditions of the pulse, for example, the rate, the rhythm, the strength, and texture of the pulse as well. So one example of this is that a rapid pulse may indicate that they're nervous, or it may indicate that it is an illness related to heat. So some modern developments is using the Doppler ultrasound to measure blood flow. So those are some of the diagnostic techniques in TCM, which is traditional Chinese medicine. Now I have some pictures to show you on this particular topic. Firstly, is inspecting. So the first one is inspecting. As you can see here, I printed out a photo, which is inspecting on patient's vitality. See if their complexion is bright or their complexion is shallow and low spirit. Inspecting the physical condition, are they built and good coordination of good movement, or do they have skinny figures, and also are they shaking too much? Inspecting the tongue or tongue diagnosis, pale red or dark red can indicate a disease or illness. Inspecting the excreta, white phlegm and yellow phlegm, this will indicate illnesses as well. Next is listening and smelling. Listening and smelling to the breathing with a wheezing sound may indicate asthma, like I said before. This is one example. One other example is phlegm with a stinky smell may indicate the presence of abscess in the gum, and I've said that before as well. Finally, questioning. Questioning means to ask the patient about the onset of the disease, the symptoms, previous illnesses, and treatment. Also the medical history as well. The headache, which feels like the sting of pins and needles, I said before, may indicate an illness caused by blood stasis. Palpating, and if you palpate rapid pulse, may suggest that the illness is probably of heat nature, so it's related to heat. So those are some of the pictures that I want to show you about. Finally, to close this video off, I'll be giving you a fun fact. Did you know that a tongue that is pale red or purple has a thick yellow, greasy texture coating can indicate a different and specific illness? Well, I didn't know that either, and that is why I think TCM is also accurate. So I think this is a very interesting topic to learn about on TCM, traditional Chinese medicine, and I feel like I could learn more about traditional Chinese medicine along with Western medicine as well. So those are all the things that I want to talk about in my video on diagnostic techniques, the 4 diagnostic techniques in healthcare. Thank you again for listening to my video. I hope to see you soon, and goodbye. See you later.